Dog hotspot. Symptoms, causes, treatments. What's the dog's hotspot? A hotspot is a very inflamed, dermatitis, red, and irritated area of the dog's skin, generally well defined in outline. At the beginning of a hotspot, there is always a small lesion, an itch, a boo-boo, often harmless, that the dog starts scratching and/or licking excessively, which leads to complications. One generally speaks about hotspots only when the small boo-boo of the dog is complicated by traumatisms that the animal inflicted itself. A simple wound, lesion, pimple, or localized redness is not a hot spot. A hot spot is often a few centimeters in diameter, is completely or partially devoid of hair, and can be more or less oozing, purulent, hollow, and sometimes crusted. Some dogs cause very impressive raw wounds to themselves, others will simply have red and irritated skin. Also, a hot spot can look like a simple red patch, as much as a real open wound. Itching is a typical symptom of this condition. In fact, it's with an itch that it all starts, as the dog hurts himself by scratching, biting, and/or licking himself. It is important to note that a dog can inflict an impressive hot spot on himself in just a few minutes if he is intensely itchy. The hot spot is also painful and often gives off a bad smell. There are two types of hot spots, pyotraumatic folliculitis and pyotraumatic furunculosis, two conditions that are treated differently. Pyotraumatic folliculitis, or simple hot spots, form large, well-defined red patches that can be recognized by their sharp contours. Pyotraumatic furunculosis are red patches surrounded by small pimples, papules, or pustules, containing pus. In this second case, the bacteria colonizing the hotspot do not remain on the surface, but spread into the dermis, lower layer of the skin, causing the appearance of deep pustules, boils. Causes of the dog's hotspot. As mentioned above, a hotspot is caused by the self-mutilation of the dog, who, overwhelmed by pain and severe itching, scratches, bites, or licks himself until it causes this type of dermatitis. Of course, a dog does not inflict such injuries on itself without a valid reason, and it is usually possible to identify a primary cause in the appearance of hotspots. Hotspot and dog allergies. Allergies are very often involved in the dog's skin disorders, from alopecia to redness, from dry and dull hair problems to various pimples and, of course, hotspots. One allergy that is frequently found in dogs is flea saliva, a pathology that even has a name: allergic dermatitis to flea bites. This disorder often manifests itself by multiple sores and scabs on the dog's body, caused by excessive scratching, one or more of which can become complicated in a hot spot. Food allergies are also potential causes of the hotspots, as well as allergies to other parasites, dust mites, lice, etc., mosquito bites, or, more rarely, contact allergies. Hotspot and dog parasites. Another common cause of hotspots is parasites of all kinds. We have just mentioned flea bite allergies, but it should be noted that a dog does not have to be allergic to a parasite bite to be severely itchy. Not all dogs have the same sensitivity to bites, and the animal's environment may also play a role in its reaction to an itch. Animals that are bored, for example, are more likely to scratch, since they have nothing else to do. Also, mosquitoes, ticks, fleas, lice, demodex, body mites, and many other critters are all suspects to consider when a dog suffers from hotspots. Outites, small red mites that are very common in summer, are responsible for very itchy skin. Scabies mites are also known to cause unbearable itching. Hotspot and dog sores. Still, among the most common causes of hotspots, small traumas of the dog's skin are to be taken into account. Poodles, typically, have sensitive skin, and brushing them can easily irritate them, especially in the cheeks. A scratch, a small wound caused by brambles or branches, a bee sting, and any other skin trauma can become complicated in hot spots. In dogs living near the sea, swimming in saltwater can also be implicated, which, when dry, can cause itching that can be more or less virulent. Hot spot and dog diseases. More or less common skin diseases may also be involved in the appearance of hotspots. Pyodermatitis, atopic dermatitis, inflammation of the anal sacs, ear infections, and conjunctivitis are all conditions that can itch your dog and cause him to mutilate himself. Rarely, skin tumors can also cause itching that can lead to hot spots. Finally, it should be noted that dogs that are stressed, anxious, suffering from pathological boredom, lack of attention, and any other ailment that is harmful to their moral well-being can develop behavioral disorders manifested by self-mutilation. Also, it is good to know that some dogs are predisposed to the hot spot, and especially to its furuncular form. These are the gentle Labrador and the cheerful Golden Retriever, but also, to a lesser extent, the faithful and anxious German Shepherd, a great specialist of self-mutilation. Treatment of the dog's hotspot. It is not customary to first treat the hotspot itself before treating the cause of the problem. A visit to the veterinarian is essential to put an end to the animal's suffering and help it stop hurting itself. The treatment involves shaving the dog's hair over a large area around the hotspot and removing any scabs and scales so that the lesion no longer macerates. Mowing usually reveals the extent of the lesion, which is often underestimated by the owner and makes it possible to distinguish between folliculitis and furunculosis. It should be noted that this procedure is generally done under general anesthesia, the pain being such that the animal rarely allows itself to be manipulated. Once the hot spot is well cleared, it is cleaned to remove pus and crusts that itch the animal and harbor bacteria, then disinfected locally. Flies sometimes lay their eggs in the dog's hot spots, in which case the wound can be colonized by eggs and maggots that will be removed, one by one, during this stage of care. To avoid this, it is important to have your dog treated in the early stages of the disease when the wound is not yet significant. In the case of poitraumatic folliculitis, the dog can go home with a collar that will prevent him from continuing to mutilate himself once the hot spot is clean and disinfected. A skin lotion will often be prescribed to soothe the itching and clean the hot spot daily, and, if the animal seems to be suffering or does not hold still, a sedative, corticosteroids, or a painkiller may complete the treatment. It is crucial to keep flies away from your pet during its convalescence to prevent them from laying their eggs, a more common complication than you might think, especially in the summer. When the dog's hot spot has become complicated by pyotraumatic furunculosis, an oral antibiotic treatment will often be prescribed in addition to the treatment to eliminate deep-seated bacteria. Corticosteroids are generally excluded from the treatment so as not to annihilate the dog's body's immune defenses while its dermis is deeply infected.